This is lecture number 35, and now we're getting into different forms of individual therapy. And we took note of the fact in our last lecture that there were three basic approaches to the therapy that we provide today for patients that are suffering from behavior disorder. And the first such therapy that I want to take a look at is the so-called biomedical approaches, meaning um, uh, the the underlying belief that the behavior disorder is one that has a defined biological basis to it. So essentially what we're saying here is that we think something is wrong with the individual's biology, and we think that we can rectify that by using some kind of therapy that is going to be influencing an individual's physiology, their biochemistry, for example. So let's take a look at these biomedical therapies, and certainly the one that I think is most recognizable to individuals, even individuals that are new to the study of psychology, is what we call electroconvulsive shock therapy. And it's really something that's been around since the 1930s. It was first used in Italy, for example, in order to treat individuals that were very depressed, and indeed with some success. When it was imported here to the United States, took on a little bit different form in terms of how such treatments were actually administered. Something that we'll get into a little bit more as we go along. But electroconvulsive shock therapy is when we actually induce a seizure in an individual, and it's typically used for treatment of very severe depression. So when we take a look at it, again, it's used since the 1930s, and it's been used with patients who really haven't responded to anything. They haven't responded to any kind of talk therapy. They haven't responded to any kind of antidepressant medication. Oftentimes they are suicidal, which certainly indicates that something needs to be done, and done quickly, in order to try to help these individuals. Typically, it is done by way of the administration of shock by way of shock paddles that are administered to various parts of the individual's body. It's applied every other day for a period of 2 weeks. And there can be very significant side effects. Brain damage, liver damage, damage to the lungs, forgetfulness. These are pretty severe side effects, and of course, when we enter into the utilization of electroconvulsive shock therapy, it's done with the knowledge that the situation is so severe that the risk of some of these side effects is something that is overridden by the danger of not doing anything. So again, it's a proven benefit typically for severely depressed patients. Again, drugs don't seem to work. Any kind of talk therapy doesn't seem to work. It is a kind of a last resort therapy used with severely depressed individuals. Another form of therapy, a more recent one, and by that what I mean is over the last 15 years or so, is that of deep brain stimulation. It's called DBS, that's the acronym for it. And this too is a treatment that is reserved for severely depressed individuals, clinically depressed individuals that really are not responding to anything else. They don't respond to medication. They don't respond to electroconvulsive shock therapy. And one individual who has been working with this for quite a period of time, Helen Mayberg, she really was the one that had pioneered the use of it. And again, it's for severely depressed patients as a last resort. So let's learn a little bit more. The technique itself involves the implantation of these very thin wires, these electrodes that you see here, that are attached to a battery pack. It's like a pacemaker, almost, that you would see for a person that has a regular heart rate, for example. But that backpack is implanted under the clavicle, and the metal wires, the electrodes themselves, are in a brain region that's called Area 25. And again, I'll have a visual of that in just a few moments. But again, it acts like a pacemaker. Area 25 is very rich in serotonin transporters, and it's a relay station for a lot of other parts of the brain, for pathways to other parts of the brain, to the hypothalamus and the brainstem, to the amygdala in the insula region, to the hippocampus, to parts of the frontal cortex, to parts of the frontal cortex that are involved in self-esteem and processing of sadness. So again, this area 25 is an area that is impacting a lot of other parts of the brain, but certainly one of the most significant impacts has to be in terms of the processing of sadness. And indeed, Mayberg has had success. It's still considered to be an experimental treatment, but she has had success, as well as others have, in the utilization of this technique for severely depressed individuals. Egas, Moniz, we're now going to get into the whole area of psychosurgery, and again, take a look at a little bit of its history. Egas Moniz, 1936, European psychiatrist. He wins the Nobel Prize for his utilization of psychosurgery. And again, he performs lobotomies on psychotic patients. And his results, which were really not on that many patients at all, but I believe it's about 8 patients, hyper-emotional psychotic patients, it did have a calming effect upon them. This is work that ultimately earned him the Nobel Prize. Lobotomy, as it was done at that time and then ultimately imported to the United States by an individual by the name of Walter Freeman, who we'll take a look at in just a moment. What is done is, 2 holes. Here's one in this hemisphere. Another one would be placed here. These are inserted in the skull and then ultimately into the cortex of the brain through a device that's called a leucotome. This is what a leucotome looks like right here. And once it has been implanted into the brain, it's rotated, and it has a cutting wire at the end. Again, here's the cutting wire. And we're able to, a surgeon is able to cut the neural fibers within the frontal cortical area of the brain. And again, this is repeated here in this hemisphere and then over here in this hemisphere. So this is what was first used by Moniz as well as by Walter Freeman. Here is Walter Freeman, who now is referred to as the lobotomist. Again, he was the one who developed a different technique, that of the utilization of an ice pick to perform lobotomies. This was in the 1940s and the early 1950s. So in a lobotomy, these ice picks are inserted beneath the eyelid, okay, and they're hammered through the eye socket. And it's done on each eye. And then once it has been hammered through the eye socket up into the frontal cortical area of the brain, then the surgeon just taps on a hammer a few times in order to get it through the bone of the eye socket, and then toggles it, that is, moves it almost like windshield wipers, and that makes cuts in the brain. And the procedure again was repeated in the other eye. So this is called a transorbital lobotomy, and again Freeman perfected this and operated on many individuals with this particular technique. The results of the lobotomy were the short-term results were very encouraging, had a calming effect upon individuals, but as the long-term effects were examined in these individuals, there are many, many negative side effects. There's a very high mortality rate. Oftentimes, the individuals were left with very profound intellectual deficits, and they were flat emotionally. Many of the patients had to learn how to do basic things all over again, like how to eat, how to go to the bathroom, how to dress themselves. The patients weren't really able to think about their past very much and articulate that, nor about the future. Was it the situation that initially there was great hope? Absolutely, there was. But as time went on, again, after these long-term studies became available, it was found that this was really a disaster in terms of what was happening. So one very famous incident is that of Rosemary Kennedy. There was a book that was written a few years back called Rosemary, the Hidden Kennedy Daughter. And it was the family made the decision to bring her to Freeman and have him perform a lobotomy on her. And indeed, it was for reasons that were probably more in terms of politics than they were in terms of what she really needed. I mean, she was acting out. Her emotions sometimes were relatively immature. But for the most part, she functioned well. But the Kennedy family believed that that Rosemary ultimately would impact the political careers of John F. Kennedy, Bobby Kennedy, Ted Kennedy. So again, the decision was made by the family, by the father at that time, to have her subjected to a lobotomy by Freeman, and again, the results were disastrous. She ended up really reverting back to a more juvenile state, which is not unusual for psychosurgery. And again, she really was unable to function normally, needed a tremendous amount of help in order to just engage in normal kinds of activities over the course of a day. So, you know, lobotomy was a disaster. Is it performed today? Rarely. Maybe as a last resort for psychotic patients in which nothing else works, and there's such an extreme threat to themselves and to other individuals that, you know, nothing else can really be done. But again, this is rare. If you take a look at what was happening as time went on, Freeman and others who were performing this surgery were doing it on younger and younger individuals, some as young as 4 years of age. This is a particularly interesting case of a young boy by the name of Howard Dully, who is still alive today. He, at the age of 12, a lobotomy was performed on him, and the reason for it was that he was undergoing some emotional changes, some difficulties in getting along with his stepmother, which is not unusual for a young boy that age. There was a book that Howard Dully wrote, which was called My Lobotomy. It's an interesting read. I encourage you to take a look at it because it might help you to understand a little bit more about this procedure and a little bit more about the disastrous consequences that it had, and indeed how it marred Howard Dully's life, not only as a young boy but as an adult. So again, I encourage you to take a look at that. Clearly, the therapy that has reached most people as far as biological-based treatments would be the various drug therapies. And indeed, one of the reasons why why lobotomies were no longer performed after about the mid-1950s was because of the advent of tranquilizers and antidepressants, which were found to be much more effective in terms of treating at least the symptoms of individuals that were psychotic, for example, or severely depressed. So again, tranquilizers, antidepressants, antipsychotics, and various hormone treatments. So let's learn a little bit about each one of these categories. Certainly tranquilizers, reserpine, Valium, chlorpromazine, these are traditional kinds of drugs that have been very helpful in terms of treating disorders like schizophrenia. And essentially what it does is to change the pattern of secretion of dopamine in the brain. The influence on the individual seems to have a calming effect upon their behavior, and indeed this is a very positive thing, and it seems to be working by way of altering the dopamine system. So that's tranquilizers. Yet another category of antidepressants, things like imipramine, for example, and Prozac. Prozac is probably one of the most popular antidepressants in the world. It's considered to be a wonder drug almost, and is used for many, many different purposes. Again, not the least of which is the treatment of depression as well as bipolar manic depression disorders. What does it do? Well, it changes the reuptake of serotonin within the brain. It also impacts the ability of the brain to produce dopamine. So it elevates mood, reverses depression. So again, antidepressants, yet another category of drugs. Then there are the so-called antipsychotic drugs, lithium, chlorpromazine. They treat disorders like psychotic-based disorders that are changing dopamine synthesis within the brain. And one of their principal actions is to actually reduce hallucinations that psychotic patients are known to experience. This is very significant because indeed it is those hallucinations that can come to dominate psychotic individuals. You know, a whole other category is that of hormones, things like estrogen, for example, and various types of synthetic progesterones like depoprovera. They change mood. They can be helpful in treating sexual disorders. They impact dopamine and serotonin in the brain. If you take a look at estrogen, for example, it reduces mood disorders, like, for example, melancholia in women. Depoprovera, on the other hand, is something that's used in order to reduce sexual cravings and sexual arousal in males. You know, unusual sexual cravings, and again, it is a drug that really works to prevent the action of testosterone. So again, you know, this is these four categories, and again, there are literally thousands of different drugs that have been created and that are now used in the treatment of individuals suffering from behavior disorder. There are some major issues to consider with drug therapies. Let me just go over a few of them. There can be side effects. Consider one such side effect, a movement disorder that's called tardive dyskinesia. It's a movement, as I said, it's a movement disorders where, for example, here's a woman who has been chronically treated with an antipsychotic drug. And she's showing this facial grimacing and lip smacking. They also show unusual movements of their arms and legs. This does not happen in all individuals, for sure, but it does happen in a significant number of them that have been treated with antipsychotic drugs for an extended period of time. There are alternatives that increasingly are popping up. Certain herbs, for example, that seem to be effective in treating certain types of behavior disorders. One such herb is what is called St. John's wort, which Europeans have used for a very long period of time for treatment of mild depression, mild to moderate depression. Recently, that is within the last 10 years, it is something that has also been used here. Again, it's an herb, it's a flowering plant, Hypericum it's called, that is grown in parts of Europe as well as in parts of the Southwest here in the United States. And it is harvested and then manufactured in pill form, and one can buy it over the counter. And it's probably the #1 treatment now for mild to moderate depression. It will not touch severely depressed individuals, however. But again, these alternatives to various drug therapies crop up all the time. Things like St. John's wort, you know, they do have some side effects that we have to be concerned about in terms of disrupting certain good enzymes and making an individual actually, you know, less responsive to certain other conventional types of drugs. They should not be taken, in my view, without consultation with a physician. But indeed, they've become more and more popular, and again, it's not something that can be controlled by the FDA, so you can buy them over the counter almost anywhere. One of the biggest questions that we have is concerning drugs is this whole idea of symptom removal. That is to say, you know, drugs can be effective, certainly in treating individuals and get rid of some unwanted symptoms, but are they actually getting at the underlying cause of behavior disorder? So it's rare then that drugs in and of themselves can produce significant and long-lasting behavior change. Drugs in combination with other types of therapy certainly is something that is utilized to a large extent, both here in this country as well as in other countries. You know, the combination of drug therapies with various types of talk therapy, psychotherapy, and so on, that is more normal, the route in terms of treating certain types of behavior disorders. Lastly, I want to just mention this whole problem with over-medication. One of the things that's happened, for example, with the treatment of young kids maybe that are suffering from attention deficit disorder or autism, for example, over-medication has become a huge problem to the point where we're now utilizing various drugs that traditionally are being used for, in the case of depression, for adults that are severely depressed. These are being used for children now that appear to be depressed. And one of the things that has happened is that there are reports of kids that have been placed upon these with disastrous results in terms of suicidal tendencies and successful suicide. So again, the whole problem of over-medication and this idea in our culture as well as in other cultures that there are pills to solve everything. That certainly is an attitude which is not one that's backed up by reality at all. So again, these are some of the issues to consider with drug therapies, and what we're going to do now in our next lecture is to move on to other types of therapy, insight-based therapies and behavior therapies.